In this overview, we're going to cover the iReport. The iReport is a report that's used to generate a list of patients that meet a specific criteria. For example, if I wanted to see all patients that had an appointment within the last 6 months, that all were checked out, I could pull back that list of patients. Or if I wanted to see all patients who are allergic to pollen and have been seen in the last 3 months, or patients who have a certain lab result over a certain amount that have been seen in the last 2 weeks, we can pull back any of those data points and grab a list of patients that meet that criteria. Where this is located is in the Reports portal in the lower left-hand corner. Once we're in the Reports portal, in the left-hand navigation pane, under the blue EMR header, we're going to navigate to the iReport. Once we open the iReport here, we'll see a couple of different things within our window. The first thing that we want to do is we want to tell the system what patient information we would like to see come back. For example, I probably want to see chart number, first and last name, maybe phone number, any of those different things that I would like to see. How we set those up is directly at the very top under the patient search columns. By default, on the right-hand column, we'll see that chart number is always defaulted there. To add items, I'm going to go ahead and open the patient demographics cabinet, and we'll see a couple of different buckets and filters we can go through. I want to go to the patient setup area, and these are all patient demographic data points. I want to add the patient's first or last name, so I'm going to go to the patient information section. To choose items to add, I'll just select them from the fields here and push them into the search columns in the right-hand side. To remove something, I can go ahead and choose any one of these and use the left-hand arrow to move them out of here. I can add other items as well that I would like to see. However, I'm okay with just chart number and first and last name. I'm going to go ahead and hit the OK button. Now, what we want to do is we want to tell the system what criteria we want to run this report off of. So to go ahead and build this, we're going to go ahead and start here with the plus button. Once I click the plus button, we see every single thing inside of the EMR that has ever been documented, and I can then choose one of these, or multiple of these in this instance, and kind of assemble what data points we want the system to look at. I'm going to go ahead and start with appointments. I would like to go into appointments, so I'm going to filter this down to the appointment folder. I want to run this based off of appointments that were between or meet a certain criteria. Other than that, we have this in the operator field. So every appointment that's greater than January 1st, 2001, or so on and so forth. I'm going to choose between. I want to see every patient that has been seen between January 1st, 2018, and let's say January 1st, 2019. I'm going to choose Apply. That's the first thing that I would like to see. You'll notice that we can continue to add criteria without having to click the plus sign right here. Next, I would like to see all patients that had an appointment during that time that also had maybe a CPT code, for example. So I'm going to go to Claims. Now, I want to look at all patients who had a certain CPT code as well, and I'm going to go ahead and say it's equal to, maybe I want all the patients who had a 99213. I'm going to apply that. And you'll notice I can continue to add more and more and more criteria to this. But right now, I can just see for all patients seen from January 1st, 2018 to January 1st, 2019 that had this CPT code used, this is what we want to look for. So I'm okay with this. I'm going to go ahead and close that out. To run this report, I'm going to choose the Search for Patients button here. This is going to run the report now. Down below, this is the entire list of patients that meet that criteria. So, like I mentioned earlier, what triggers these data points to show up were from our patient search columns that we did at the very top here at the very beginning. That's what's going to determine what patient demographic information appears here. At the very highest level, I can see the grand total of the amount of patients. We can see 52 patients meet that criteria. We can scroll up and down through this. Additionally, I can send these patients a letter. So let's imagine that I wanted to get all of these patients that met a certain criteria, maybe diagnosis code, problem list, lab results, any of those things, and I wanted to send out a blast to all of those patients. I can do that quickly by sending them a letter. I can also print or export this by clicking the print icon here, and I have the option to print a PDF, or I can export it to Excel if I so choose to. Lastly, at any point, I can save off a report that I like by clicking on the floppy disk or save icon right here in the upper left-hand corner. And then I can give a name to my report to then run at a later date if I want to amend any items on here. To open a report that we've saved, we'll just click on the little folder icon right here in the upper left. Any of the ones that we've saved, we can click directly on it and hit the OK button to open that report. Lastly, anytime I open a saved report, I can edit any one of these fields simply by double-clicking on it, and this will pop open exactly what we've entered, and we can then amend dates if I was working off of dates, or procedure codes if I was working on procedure codes, so on and so forth. This concludes our high-level overview of the iReport.